All right, let's point out some blood vessels. Let's start with the anterior circulation. So the internal carotid arteries are always easy to identify, very large. Okay, and so off of the internal carotid artery, let's first follow the middle cerebral artery, which is right here. Okay, and this is going out through the sylvian fissure. Okay, so remember before, we pulled apart the temporal lobe to show the insular cortex, and I told you before, here are all the branches of the middle cerebral artery. Okay, well, this is where they come from the internal carotid artery, and then here is the middle cerebral artery with all of its massive branches. Okay, also coming off of the internal carotid here, notice there's a blood vessel that is moving medially, and if we pull the optic nerve back and the optic chiasm, you can see this is the anterior cerebral artery. Okay, so we have an anterior cerebral artery coming from the other side, and notice that they join together right here, and this is the anterior communicating artery. So if we want to follow the anterior cerebral arteries back, I need to pull apart here the interhemispheric fissure, and can you see right here there is a right and a left anterior cerebral artery. Okay, and these loop right over the corpus callosum, which we'll dissect here in just a few minutes, and supply midline structures of the brain. Okay, so the right and left anterior cerebral arteries communicate via the anterior communicating artery. Now the posterior communicating artery is the link between the anterior and posterior circulation. So I've already pointed out here the posterior communicating artery. Okay, and that comes back here to the posterior cerebral artery. And again, there's our third nerve right there. Okay, but let's back up here and let's show the posterior circulation kind of from its origin. Okay, now unfortunately this brain, the blood vessels down here were cut off already. We can see, of course, the right and the left vertebral artery. And these join to form the basilar artery, which is lying right on the pons. Okay, I can point out though that notice off of this vertebral artery, we can see a branch right here, and this is the anterior spinal artery. Okay, a little bit, you can see some connections here of the anterior spinal artery to the medulla. So the anterior spinal artery is an important blood supply of the medial medulla, including the medullary pyramids. Well, these tiny little blood vessels here are coming off of the anterior spinal artery, and it's unfortunate we can't see the other half of it. Okay, but really important, this supplies the medial medulla, and it actually continues all the way down the length of the whole spinal cord. Okay, what we can't really see well here is the pica, the posterior inferior cerebellar artery. Okay, here's a little branch of it right here, but it's disconnected from the vertebral. But I'll just point out here that the pica supplies the lateral medulla. Here's the inferior olive and the lateral medulla. And the pica also supplies the undersurface of the cerebellum. So all of these branches right here on the undersurface of the cerebellum are coming from the pica. So again, the pica supplies the lateral medulla and the undersurface of the cerebellum. All right, as we move forward here, again, here's the basilar artery, and the first large blood vessel off of the basilar artery is right here, and this is the anterior inferior cerebellar artery. So let's just follow this, and notice it's going all the way back here to the cerebellum. Okay, so this is another important blood vessel in terms of vascular supply of the cerebellum. Okay, there are also some branches here that will supply a portion of the pons as well. Okay, and notice also the relationship between the anterior inferior cerebellar artery and the 8th nerve right here, because we will talk about occlusion of this blood vessel as really the only stroke syndrome where patients have hearing loss. Okay, because we'll talk about that relationship later. All right, so here's the basilar artery, and if you just lift up the basilar artery, you will see it's all of the blood vessels there that are supplying the pons. So basilar artery supplies the pons. Lots of penetrating blood vessels here. Just look at all of these going back here to supply the pons. Okay. And so the basilar artery, if we just follow it up, it terminates here as the posterior cerebral artery. So there's the posterior cerebral artery. Okay, and again we said the posterior cerebral artery is kind of this link via the posterior communicating artery with the anterior circulation. Okay, but before that there's one other blood vessel, and this is the superior cerebellar artery. So the superior cerebellar artery is going back here to supply the superior portion of the cerebellum. Okay, so we've seen the three blood vessels here that supply the cerebellum. SAP, superior cerebellar artery, anterior inferior cerebellar artery, and we couldn't really see much of it here, but the pica is down here, the posterior inferior cerebellar artery supplying the undersurface. So notice, again, here's the third nerve, that the third nerve is sandwiched between two blood vessels. The superior cerebellar artery below, the posterior cerebral artery above. Okay, but remember clinically, the PCOM right here, that our aneurysm that will give us a third nerve palsy is usually of the PCOM, posterior communicating artery. Okay, so let me say one more thing here about the posterior cerebral artery right here. Notice that it is wrapping right around the cerebral peduncle. The cerebral peduncle right here is a part of the midbrain. All right, so the posterior cerebral artery, we have a bunch of little penetrating branches here that are going down to supply the cerebral peduncle and the midbrain. So think of the posterior cerebral artery with supply of the midbrain, the basilar artery with supply of the pons, the anterior spinal artery down here with supply of the medial medulla, the pica out here with supply of the lateral medulla. Okay, so that's your vasculature of the brainstem. Okay, a few other things here before we do some cutting. First, I just wanted to point out here that I mentioned here the optic nerves and the optic chiasm. This is the pituitary stalk right here. Now, the pituitary is always gone on these brains, but that relationship between the pituitary and the optic chiasm is really important, okay, because if we have a tumor here, it tends to compress on the optic chiasm. Okay, and that gives patients a very distinctive pattern of visual loss, which we will talk about, called a bitemporal hemianopsia. Okay, so if the patient has that pattern of visual loss, it's usually a pituitary tumor. The other thing I wanted to point out is, if we can get a look right in here, we see these two kind of rounded bumps right there. Okay, those are the mammillary bodies. Mammillary bodies are part of the hypothalamus. So actually my probe right here is pushing on the hypothalamus. Okay, so the mammillary bodies are kind of the floor of the hypothalamus. Don't get these confused with the superior colliculus and inferior colliculus. Those are also rounded bumps, but they are on the posterior, dorsal surface of the midbrain, or just above the midbrain. All right, a couple of other things here. If we just look at the back, here's the cerebellum. Okay, and just to appreciate here the difference between a gyrus, really large, and the very fine, delicate folia of the cerebellum. Cerebellum has a midline portion that is called the vermis. Okay, just lateral to that is sometimes called the perivermis, and then we have the lateral cerebellar hemispheres out here. So the general rule is the more lateral the lesion is, you're going to have more distal ataxia. So a lesion out in this portion would give a patient mainly ataxia of the arms. So the hands are very clumsy when trying to perform any task. The closer we get to the midline, the more we have a truncal or a midline ataxia. So patients that have alcoholism, that frequently will involve the vermis and the anterior lobe of the cerebellum, and so they mainly have ataxia when walking, have a really wide-based, unsteady gait. Okay, and I think the last thing I wanted to show is if we just pull the cerebellum back, okay, now we are looking right now at the back of the midbrain. Okay, and so notice we have what's called the quadrigeminal plate right here. Okay, so this is the superior and the inferior colliculus. The superior colliculus has a number of important functions. We'll talk about a pathway that travels down to the cervical spinal cord. Actually goes from the superior and the inferior colliculus. It's called the tectospinal tract. Okay, this area is also sometimes called the tectum. Okay, that's important for moving your head in response to visual or auditory stimulus. So the superior colliculus has to do with vision. Okay, not visual acuity, but as I mentioned in this case, turning your head appropriately to a visual stimulus. Okay, a lot more we could say about that. The inferior colliculus is important for auditory. It's a relay nucleus for the auditory pathway. Okay, so the inferior colliculus in terms of the tectospinal tract would be important for turning your head toward an auditory, a sound, that you can appropriately do that. All right, now the other important thing here is that the only cranial nerve that exits the dorsum of the midbrain is found back here. So this is the trochlear nerve, which comes out just below the inferior colliculus. So we can see it here on this side, and on the other side, there's the trochlear nerve. Remember, the trochlear nerve, like the sixth nerve, just supplies one muscle. It supplies the superior oblique. And so this nerve, because it's small, and also because it has to travel so far, it goes from the back of the midbrain all the way around. I showed it wrapping around the cerebral peduncle. Let's see if we can do that again. Okay, it's kind of mixed up here with blood vessels. Okay, but here it is going all the way around the cerebral peduncle, all the way out to supply the superior oblique. So oftentimes this nerve will get damaged in head trauma, and then patients complain of double vision, and especially when trying to look down and in, like reading or trying to read a book.